9-year-old Asma Hassan is the latest case at this district hospital in southwestern Somalia. The local medical team is on hand to deal with her case, and minutes later her mother breathes a sigh of relief. She's informed that her daughter's health condition will improve soon. Asma is among hundreds of children affected in this region that's ranked among the worst hit by the devastating drought that's threatening 6.2 million people, more than half of Somalia's total population.
My daughter started vomiting last night. I was concerned that it was diarrhea and brought her to this hospital. She's now in safe hands. The medical teams here are trying their best to save her.
Health officials here tell me that the number of children admitted to feeding centers such as this have doubled over the past months, despite heavy rains recorded nationwide. This is the only cholera treatment center in the Billow region, a region that continues to face immense health challenges. And since January, it has catered for over 4,000 cases, with 50 deaths reported so far.
The
situation was worse in the months of January, February and March. Per day we recorded 65, 60 and 70. In mid-January we recorded 145 patients in a single day from Baidoa and its surroundings. Others came from blockaded regions, especially from Wajid.
However, there are new concerns here. Cholera outbreak is expected to worsen due to the ongoing rains. Authorities here are teaching the local community on the importance of hygiene and clean water. And the medical team is also spraying affected wards using chlorine to reduce infection.
A lot of emphasis has been placed on hygiene and clean water. Medical officers, locals with support from local and international organisations have helped reduce the crisis, but with the onset of rains, waterborne disease is with us again. In May, we've already lost 3 lives due to acute water diarrhea.
Aid agencies such as ICRC and UNICEF are continuing to support the Billow Regional Hospital with medical supplies and vaccines, but it doesn't fully address the growing needs on the ground.
The impact is significant. The problem is that once these children and their parents go out there, we need to make sure that they can remain the nutritional status, and that is a challenge because the entire community here, all around Baidoa and in Baidoa itself, is in a critical situation.
The United Nations says that up to 1.4 million children in Somalia remain malnourished, including 367,000 who are at risk of likely to suffer from severe acute malnutrition in the coming months. Abdulaziz, Billow, CGTN, Baidoa, Somalia.